This short presentation on the influenza and pneumococcal vaccinations is intended to provide you with information about these vaccines, how to find vaccination history in the medical record, how to add vaccinations to the medical record, and how to answer the OASIS questions about vaccinations correctly. Vaccinations are the best way to prevent some serious conditions such as influenza and pneumonia. Patients seen in home care tend to fall into high-risk categories for which the influenza and pneumococcal vaccinations are indicated. Every patient who is seen in home care must be assessed for these vaccinations at start of care and resumption of care. However, it's the responsibility of each clinician working with the patient to ensure the vaccination history accurately reflects these vaccinations. Let's first discuss the influenza vaccination. Influenza is a contagious respiratory illness with symptoms that range from mild to severe and at times can lead to death. Influenza spreads mainly by droplets from coughing, sneezing, and talking. The severity of any given flu season is unpredictable, which is why it's important to encourage appropriate patients to receive the vaccination. There are certain populations identified by the Centers for Disease Control who are considered high risk. These include children younger than 5, especially younger than 2 years of age, adults over the age of 65, and people with any of the following conditions: asthma, neurologic conditions, heart disease, weakened immune systems, liver disease, kidney disease, and morbid obesity. At transfer or discharge from the agency, clinicians have an OASIS question regarding the influenza vaccination. The question asks, did the patient receive the influenza vaccination from your agency for this year's flu season, October 1st through March 31st, during this episode of care? Our options are no, yes, and NA does not apply because the entire episode is outside of the influenza season. In order to answer this question correctly, you must know 3 things. 1, when is the flu season? 2, where is the flu vaccination record located in home care home base? And 3, did HCR Home Care provide this vaccination? So when is flu season? The actual flu season varies from year to year and is determined by the CDC. However, for OASIS purposes, the flu season is October 1st through March 31st. If we are answering this OASIS question outside of the flu season, then the response will be NA. However, remember, if any part of the patient's episode of care has occurred during flu season, we can only respond yes or no. So where do you find the vaccination records in home care home base? First, you can find vaccination history in the medical record of any patient. Remember, medical records can be viewed outside of a visit under features and inside of a visit. During any patient visit, you will also have the ability to add vaccinations by going into the PRN section. Within the PRN section, you will have the ability to choose vaccinations and add them if you administered them or discovered the patient had them administered. Within the vaccination section, you'll be able to choose either influenza or pneumococcal vaccinations, indicate who administered the vaccination, perhaps HCR, or a physician or another healthcare provider, and the date the vaccination was administered. So let's get back to the OASIS question. So we are asked if the patient received the flu vaccination from our agency. If the entire episode did not occur during flu season, we can respond NA. If we did provide the flu vaccination, then we can respond yes. If we did not provide the flu vaccination and the episode occurred during flu season, then we will respond no. If we respond no, we will be asked an additional question to clarify why we didn't provide this vaccination. Here are the 7 options to choose from for why we did not provide the flu vaccination. You'll need to choose the most appropriate response. Choose number 1, receive from another healthcare provider, if the patient received the vaccination from a physician, a physician's assistant, a nurse practitioner, or any other healthcare provider. Choose number 2, received from your agency previously during this year's flu season, if the patient received the vaccination from HCR Home Care during a previous episode of care that has occurred during this flu season. Choose number 3, offered and declined, if we offered the patient the flu vaccination and they refused. Choose number 4, assessed and determined to have a medical contraindication, if the patient has a contraindication such as anaphylactic hypersensitivity to eggs, a history of Guillain-Barré syndrome, bone marrow transplant within the past 6 months, or if there are physician medical restrictions. Choose number 5, not indicated, patient does not meet the age or condition guidelines for the influenza vaccination, if they are not in the high-risk population discussed earlier. Choose number 6, inability to obtain the vaccination due to a declared shortage, if there is a nationwide or regional shortage in the vaccination. And choose number 7, none of the above, if no other option applies. Now let's talk about the pneumococcal vaccination. Pneumococcus is the most common cause of bloodstream infections, pneumonia, meningitis, and middle ear infections. Transmission of pneumococcus occurs by direct contact with respiratory secretions such as saliva or mucus. Populations at high risk for developing pneumococcal infections include adults over the age of 65 and adults with any of the following conditions: lung, heart, liver, or kidney disease, asthma, diabetes, conditions weakening the immune system such as HIV, AIDS, or cancer, individuals living in a nursing home or long-term care facility, or individuals who smoke cigarettes. So let's look at the OASIS question. We are asked at transfer and discharge if the patient received the pneumococcal vaccination from our agency during this episode of care. Our response options are no and yes. In order to answer this question, you will need to know 1, did HCR provide this vaccination during this episode? And 2, has the patient ever received this vaccination? Again, we can find the vaccination history in the medical record under Vaccination History. We all have the ability to add vaccinations through the PRN section as well. Through the PRN section, we can add any new vaccination obtained or update the vaccination history during any home care visit during the episode. So the OASIS question asks if we, HCR Home Care, provided the pneumococcal vaccination. Our choices are no and yes. Choosing yes, we are indicating that we, HCR Home Care, did provide the pneumococcal vaccination during this episode of care. Responding no indicates that HCR did not provide the pneumococcal vaccination. If we respond no, we will be asked to clarify why we didn't provide this vaccination. Here are the choices that will appear if we indicate that HCR Home Care did not provide the pneumococcal vaccination. Choose number 1, patient has received the pneumococcal vaccination in the past if the patient has ever, in their life, received the pneumococcal vaccination. Choose number 2, offered and declined, if the patient was offered and they refused the vaccination. Choose number 3, assessed and determined to have a medical contraindication if the patient has an anaphylactic hypersensitivity to the components of the pneumococcal vaccination, or if they have had a bone marrow transplant in the past 12 months, or if they have undergone chemo or radiation within the last 2 weeks. Choose number 4, not indicated, the patient does not meet the age or condition guidelines if the patient is not included in any of the high-risk populations previously discussed. And finally, choose number 5, none of the above, if no other response is appropriate. To summarize, remember that we can work together to keep our patients healthy through offering and encouraging vaccinations, monitoring and educating our patients on the value of vaccinations. You can update the vaccinations during any visit through the PRN section. Finally, make sure you review the vaccination history before answering the OASIS questions at transfer and discharge. If you have questions about any part of this presentation, you can email Clinical Education by typing in Clinical Education into an email search or by using the lookup feature on your device. On behalf of the Clinical Education team, we thank you for your time.